Okay, friends, well, thank you very much for continuing along with the weight connection seminar. Now we're going to start talking about the weight right for your type. How many here have heard of the Eat Right for Your Type? Yeah? Okay, so the Eat Right for Your Type is a number of books that were written by someone that claimed that depending on your blood type, you ought to eat certain things. Okay, so you have the A type, the B type, the 0 type, or the AB type. And depending on that type of blood type, certain things will do better for you and other things will not do as good. Now, we have the weight right for your type. When somebody asks me, what do you think about Eat Right for your type, for your blood type? I said, how many types? There's 4. I said, I don't believe that. And they said, why not? I said, how many people in this earth? I said, well, about close to 7 billion. I said, I believe that. There's actually 7 billion types of people because you are an individual. If you have children, you know that they are different. We have 3 children of our own. My son is 16, my daughter 14, and another daughter of 12. And then we have 2 adopted children, one of 6 and one of 4. They're all different. One craves more certain things, other craves more certain other things. One is thriving by olives. The other one is just doing like this, getting the olive and passing it on to the brother because he doesn't like olives. Now, I have to like olives. I'm from Spain. If I don't like olives, they take away my passport. You know, this is a matter of national interest. So, how many here does not like tomato or have found that tomato is not good for you? Now, there's already 3 people here. 4 people, okay. Now, for those that love tomato, how many here love tomato? They like tomato. There you go. Now, friends, what's wrong with those 4? There must be something wrong with them. Yep, they're different. They're different people. You know, you can still go to heaven if you don't like tomatoes. You know that, right? As long as you like mangoes and bananas, you should be all right. Who doesn't like mangoes? There's people, unbelievable, don't like mangoes. And that's disregard of your blood type. Disregard of your blood type. Now, in some of those blood types, you actually have soy as one of the protein substitutes, okay? And soy is very, very good, unless it's very, very bad for you. Did you get that? Soy is very, very, very good, unless it's very, very bad for you. People ask me, what do you think of coconut oil? I say, coconut oil, great, unless it's very bad for you. One of the things that I say often is, it depends. It depends. I just had an email, one of my patients, just before I actually checked the email before this lecture. One of my patients, she is from outside Australia. I won't say where, but she's from outside Australia. And she said, Oscar, that elimination diet that you got me on, I'm doing very, very well. I finally got through introducing some of the nightshade family. Nightshade family, the tomato, the eggplant, the potato, and the capsicum. And I said, I'm bloated again. I just introduced the tomato. I'm bloated again. She was bloated for the last 3.5 years. We actually put her on a particular protocol and she is doing fine. She can actually sustain herself in that protocol. But and I knew she was going to react to tomatoes. I already kind of guessed it. But she kept on putting pressure on me. So the best thing is like you do with your children, you know that they're going to get hit against a wall, but you cannot stop them. So what do? You let them hit themselves against the wall, and then you're there to pick up the pieces. So I actually sent her and said, okay, you introduce a tomato for 3 days and see how you're going. Bloated. Extremely bloated. Bloated by a tomato. Can you believe that? Yeah, for that person, yes. Every person is different, and every person has different requirements. If this was as easy as I just put a template and I have 1,000 patients coming through with all different things, and the 1,000 people come there, they pay their fees for the consultation, and I just print out my template, I said, there you go, off you go, that will work for you. If it was that easy, I could have saved a lot of years at university. It's not that easy. There's actually many people that they just heal everything with ginger. Have you met those people? It's amazing. They heal everything with ginger. I had a patient with Gilbert's disease. And a friend of mine came to me and said, anything new in the clinic? I said, I've got a patient with Gilbert's disease, and we're working through it. Gilbert's very high levels of bilirubin, okay? Dismantles very, very quickly the red blood cells. It's a genetical disease in most cases, unless you're being exposed to radiation like this person, okay? So I'm just breaking my head trying to work out a few things because she's reacting to many things. And then the person that heals everything with ginger comes around and said, have you tried ginger? Now, sometimes it's not that simple. And sometimes it is just a matter, it becomes simpler once we understand who you are and your different characteristics as a person, as an individual. So I don't believe in eat right for your type, meaning 4 types. I believe eat right for your type, meaning 7 billion people. And in terms of the weight, we need to understand something of our type, okay? Here comes a disclaimer again, that the Weight Connection seminars are designed to share valuable information with the general public. They are not to be used as a treatment for individual cases. Consult with your health professional, okay? Now, one of the things that we need to understand is what is our type, what type we have. So what I'm going to do now, I'm going to put an image in the screen there, and you are going to try to figure out what is your type, okay? Are you ready? I'm going to put the image there. Please try to work out what is your type. There you go. Okay. So which one is you? Now, are they all dogs? Are they all dogs? All of them dogs. Isn't that amazing? Are these 2 dogs? They are dogs. Now you tell me which one is overweight, the Great Dane or the Chihuahua? Oh, come on, neither. There's one that is almost over 50 kilos and the other one is just making it to 2 kilos. One has to be overweight. None of them? Both of them dogs, but not necessarily both of them overweight, despite the fact that one is almost 50 kilos, the other one is just 2. Now, if you actually do this to my son, or if my son does this to himself, he's 16, he has already bigger back muscles than me. Now, look at my hand here, okay? I'm just going to put my index with my middle finger here, my thumb, with my middle finger there. Look at this. I can cover, can you see it there? Can the camera see that? I can actually cover the nail of my middle finger as I go around. Can you check on yours? How many of you cannot even reach from one end to another? There's some people that cannot even reach from one end to another. How many of you have heard of, I'm just heavier because I have big bones? And we're thinking, Yeah, sure, that's a pure excuse. Well, the thing is that I don't have big bone mass. The weight of my skeleton is not going to be that much because, this is a very quick assessment of that, I actually have thin bones. That's my frame. That is me. If you actually have bigger bones, this is just a very quick thing to check. If you actually have bigger bones, you need to understand that even at your prime weight, you're probably going to be of the higher scale, of the higher end of your weight because of your bone density, because of the weight that your bone is adding to your total weight. You understand? I have many people that come to me and they want to put on weight. And I check the BMI, I check the body fat percentage, and I realize that they are borderline to the lower end, very, very borderline. And I check what they eat, and they're eating well, and they're introducing enough protein, they're introducing enough fat, they're introducing enough calories, etc., etc. They are actually eating very healthy. So what do I say to them? Don't worry, you're just a chihuahua. You're just a chihuahua. There's actually chihuahuas out there, you know? Men and women that are chihuahuas. Now try to make a chihuahua out of a guy from Tonga. That is going to be an impossibility. I mean, most of the guys from Tonga, they will not be able to be any lower than 80 kilos and look healthy. Of course, they don't have to be 190, 180 kilos, you know, close to 400 pounds. But it's going to be very difficult for them to lower their weight and be healthy any lower than 85 because they have huge bones, huge frame, and they're a different type of individual. You following? Okay, so for instance, are these dogs overweight? They are overweight. Okay, in Australia we have something called the RSPCA. It's the Rescue for Animals and so on. If I have that dog in my house, my neighbor will call the RSPCA, and the RSPCA will take the dog and will take me to court for animal cruelty. Okay? So bear that in mind, that will actually be considered animal cruelty in Australia. Is that greyhound overweight? That one is not overweight, but what about that one? That one is underweight. So that skinny greyhound on the left is not overweight, neither underweight. It is the weight. Okay? Are you following? I'm trying to start getting you into a mindset, first of loving yourself, okay? Accepting that you're different, and the magazines are not helping with that. The magazines are not helping. And at the same time, also recognizing that there is a bracket of healthiness that we need to try to aim to, okay? So, for instance, now there are about 7 types of body types, okay? I haven't included the other 4 because in a way they are sub-levels of these 3, okay? How many here have heard of the All Blacks, New Zealand All Blacks? Okay, the All Blacks are the rugby team of New Zealand. How many here have heard of the Wallabies? The Wallabies are the Aussie team. So there's a lot of fight, a lot of competition between the Aussies and the Kiwis. You know, we call Aussies and Kiwis, the New Zealanders and the Australians, you know. Now, when you look at the rugby team, the majority of the rugby team members will be this type here, the endomorph type. Thick neck, big muscle, big frame. The majority of the players will actually be that type. Okay? That's the makeup of the team. This is the type that all of us hate. The ectomorph is the type that all of us hate. Is the one that eats whatever at any time of the day, eats plenty of it, and is always skinny. It doesn't put on weight. This is the type, on the other end, the endomorph, is the guy that then quits doing sports, quits the rugby, and he just gets big and big and big. This is the type of individual that will look at a cake, look at it, and will put on 2 kilos. You know, have you heard that? I'm looking at water and I'm getting bigger already. Okay, now, the requirements in each of these 3 individuals are totally different. The one in the middle is that guy in high school that will appear not to do much exercise, though he was fairly athletic, and he was the first one in taking the shirt off. You know, the first one that will take the shirt off and to show the six-pack. Okay? The six-pack will be there. Do you know that everybody has a six-pack, by the way? Okay, six-pack here. Okay, everybody has a six-pack. Some people have it more covered than others. That's the only difference. In Spain, we don't call it a six-pack. In Spain, they actually call it the chocolate tablet. You know the chocolate tablet with the little squares there? Chocolate tablet? So I just figured out that some people have chocolate tablets and others have chocolate mousse. But we all have something there. It's called the core muscles. Okay, all there. So this is the type of guy that is the athletic type of guy, but it will take longer for him to put on weight. When this guy gets heavier, he will go from his 75 kilos to 90 kilos, the one in the middle, as a male. And he just put on weight. When the one on the right, the endomorph type of guy puts on weight, he starts with 85 already, and he will be very easy over the 100 kilos, over the 200 pounds. Very, very easy, and more and more and more. When this guy, the ectomorph, puts on weight, it's funny how it looks, because he's now in his 55 or 60, and you look at this guy from behind like this, and still skinny. Skinny legs, skinny arms, still skinny. And then he turns, and he has like a 7-month-old baby inside. That little gut. Okay? This is what we call the skinny fat. So he's skinny, but he's fat. This is the guy that will drop down with a heart attack. And he wasn't heavy. And he wasn't overweight. Then we have also the happy fats. They are the ones that they're overweight, but the arteries are very, very clean, and they're not actually very close to a heart attack anyhow, because they're happy. We'll talk about that in future presentations. Okay? So, what these types of individuals need is different in regards to energy, because their metabolism, in other words, the rate in which we burn energy in the furnace of the cell, is different. There are people sitting here now that just by sitting down, you're burning more calories than your neighbor sitting next to you. Isn't that unfair? That's unfair. There's somebody here that is actually burning a lot of calories just by sitting down, while you are not burning as much. That's because that person is burning the calories faster. The metabolism is actually going faster. So, in these cases, there's an individual that is just dealing more. For instance, the ectomorph type of individual is a more thyroid type of person. The thyroid is stimulating very fast metabolism. Okay? The one in the middle is a more adrenal type of person. The adrenal glands has a bigger contributor in the metabolism. While the third one on the right is a more pancreatic or insulin metabolism. Depending on the levels of insulin, that will depend on how fast the metabolism is running. Okay? So, the amount of carbohydrates that each individual will need is going to be different. Because what gives us the energy ultimately is glucose, and glucose is found in carbohydrates. Okay? That's what gives us the energy. So for instance, this person over here will have to consume about 80% of carbohydrates in a daily input of food in order to maintain his weight. If he goes into one of those low carbohydrate diets that are up there, that guy will not need to open the door anymore. He can actually go through the cracks. He will disappear. Now, if you give the person in the middle, the mesomorph, 80% carbohydrate in his diet, he'll slowly but surely start putting on weight. You'll start losing that leanness of his muscle and start becoming a bit more chubby. And slowly he will just put on, slowly, he'll start putting on weight, okay? Until he gets to the 95 kilos. If you give the person on the endomorph category 80% of carbohydrates, that person is going to get real big. He's going to get very, very big, okay? Now is when it becomes tricky, because your body shape is controlled by hormones, either from the thyroid, even from the adrenals, even from your pancreas, okay? And events in your life can actually shift those inputs. So you can actually be adrenal dominant until the age of 40, then you change your lifestyle, you sit down behind a desk, you start gaining weight, and all of a sudden you become more pancreatic. And you were just gaining just half a kilo each year, and then it shifts and you start gaining 2-3 kilos each year. That's when it becomes tricky. Because I used to be like this, and now I am like this type of metabolism. Okay? So percentages are different. Now, as we go along with hormones, we will disclose it further. But I'm just going to tell you a story to illustrate. This is a husband and a wife that came to see me. He was this type, okay? The ectomorph, the very skinny type of guy. He didn't need to lose any weight. He was a very active man. He could not stop. He was like, he will eat and he always had to do something. He's like he's pushed by his metabolism. Okay? He's just burning. That guy is sleeping and he's burning. He's snoring and he's burning. That's unfair, isn't it? Now, the wife, she was definitely insulin. Her metabolism was controlled or determined a lot by the level of insulin. Okay? Before they came to see me out of desperation because they watched a video on juices, like vegetable juices. And he decided to say to the wife, honey, why we don't do it together? We'll do it for 2 weeks. She needed to lose 25, 30 kilos. He didn't need to lose any. Okay? We'll do it for 2 weeks. And I'll do it with you just to support you. He just did it just to encourage the wife so she can lose a little bit of weight. Now, 2 weeks passed. He didn't need to lose anything. He lost 5 kilos. Now, how many kilos did he lose? 0. Now, how frustrating that is. You've been getting up every morning to a whole full glass of carrot juice with ginger, because he has to have the ginger, because ginger cures. Remember, ginger cures everything? And the ginger, and just half an apple, and the kale, because kale is very good, and so on. Now, it worked for him. It didn't work for her at all. Because she was insulin dependent. The metabolism was run and determined mainly by the levels of insulin that she is pouring out. Okay? And we'll deal with that as we go along. But this is something that we need to understand. Every individual is different. And in the context of losing weight, the percentage of carbohydrates are going to be very, very important. Very, very important. So I'll repeat again. This individual here, in order to maintain weight, will need 70 to 80% of carbohydrates at any given day in order to maintain his weight. Otherwise, he will disintegrate and disappear. This person in the middle, we're looking at between a 50% carbohydrates, okay? This person on the right, the endomorphic, in order to lose weight or maintain weight, we're looking at 25% to 40% of carbohydrates. Now, this is not a low carbohydrate percentage. A low carbohydrate percentage is anything under 12. We're talking about 25%. You understand what I'm saying? This is not a low percentage of carbohydrates. We are or like no carbs diet. That will be at under 12%, 12 to 0%. That's not what we're talking about here. We're talking about that person will need between 25% and 40% of carbohydrates in order to either lose weight and or maintain weight. Failure to do so is going to be that person is going to add weight. Okay? We're going to follow that through these seminars. Now, how many here have heard of the BMI? Body Mass Index. Okay, so I'm 74 kilos. So, and I'm 178. So I'll just get that one, 177.8. And I'll just go to 74. So I'm there. Hey, I'm 23 there. So I'm on the green. So I'm good, right? It depends. It depends. Because let's say that I've now become a bodybuilder. Just imagine, okay? And I actually gain a lot of muscle. So I put on an extra 5 kilos of muscle, not of fat, of muscle. That means that I will be 80 kilos. So that's my height. I'll just go to the 80 kilo. Okay, man, I'm already on the yellow there. That means that I'm a little bit, overweight. See at the top, overweight for the yellow. Why? Because I put on 5 kilos of lean muscle. Am I at any risk of diabetes? I'm overweight now, according to the chart. Am I at any risk of diabetes? Probably less than before. Because my body fat percentage has lowered and my muscle mass has actually, and my lean body has actually improved. Let's say I gain 10 kilos of muscle. So now I'm 85. So I'm 177.8. And I just go here, 85. Man, I'm getting very close to obese. And I check off my body fat percentage, and I'm on a 10% body fat percentage. Am I at any risk of diabetes? No, not even near. So I'm 10 kilos over the recommended weight for my height, and I'm not even near. However, you can actually have people on the green that are just this close from having a heart attack. How can that be? Because when we're talking about weight, we're talking about what is the percentage of your weight that is fat. That's what we're talking about. What is the percentage of your weight that is fat? Not lean muscle. Because the fat starts gathering around here. What is here? Your liver. Have you heard of fatty liver? What is here? Your pancreas. Okay? Your adrenals are here. That's the first thing. That's all the reservoirs here of fat around here. That's where your adrenals are. So that is going to affect metabolism. It's going to affect the metabolism of fats, the metabolism of insulin, and a few other hormones there. That is where you are at risk. Your arteries are going to clog up, and that's what I said before, the skinny fats. They're skinny, they are on the green. They got great body mass index, but they are actually at risk of a heart attack. They are actually at risk of diabetes. You can actually have two people, one that is overweight and has diabetes, and the other one that is actually skinny and has diabetes. Because it all is not about the weight as a whole, but how much percentage of that weight is fat. For instance, let's say you are 100 kilos and you have a body fat percentage of 35. How many kilos of those 100 is fat? 35 kilos. That's a very heavy backpack. And where is all that? A lot of it is what we call visceral fat. It's in here. It goes yellow and then dark yellow and then brown. When it gets brown, very established there, very hard to get rid of, and it's influencing a lot of mechanisms in your body. You are at a very high risk of diabetes, very high risk of many other disorders, high blood pressure, etc. Okay? So what we're looking at is the body fat percentage. When we want to gain weight, what type of weight do we want to gain? Lean muscle weight. It's not about, I'm going to now eat 3 plates of pasta every day, so I'm actually going to gain weight in the form of fat and increase my risk of diabetes and high blood pressure. That's not the type of weight that I'm going to talk about. It's actually the body fat percentage. When we want to lose weight, we want to lose weight from the right places. And when I'm saying from the right places, I'm talking about not from muscle, but rather from fat. Because the right places, that's a bit complicated, you know. Because, especially women, you know. I start losing fat, so I start losing weight. I start losing weight where I don't want to lose weight. But when I want to lose weight, or when I want to lose weight, I want to hear. Can you make it that I lose from here? From here. See how it hangs from there? I want it there. I don't want it from here. I want it from there. Sorry, I cannot determine where your body chooses to start the rebalancing. Okay? But that positioning I cannot help. That is up to your body and the metabolism of your body where it's going to start taking out first. Okay? But we wanted to get it from the fat. Now, for instance, if you are a woman and you are between 20 and 40 years of age, a healthy range is between 21 to 33. Okay? Notice if you are a male of the same age, between 8% and 19. Quite a lot of difference. Why? There's a lot of difference. You know, I'm very, very concerned with some of the magazines that are coming out now with the images of women. They have a body fat of under 10%. Those women are going to have issues, hormonal issues, big time. If not now, later when they're trying to have babies, or later when the funny time comes of the menopause. Okay? They're going to have issues. Because men, they only need fat that fat that men have to help them with hormone production. You know, men only need to worry about a couple of hormones, you know, testosterone and adrenaline, and maybe insulin. I'm just exaggerating here. And we only have to worry about that one. You know, mainly testosterone, right? As men. Now, women are different. Women have to worry about and all of those hormones, and they go like this, and then very, very high towards the 3rd week, and then very, very low, and then very high and very low, and it's a whole roller coaster, right? So you got the women need that extra. Now, we actually talking about from 21% to 33%. So if you are 100 kilos, 21 kilos can be fat, or up to 33. The problem is that when we are overweight, normally we very, very close to a 40% of body fat. Now, notice this. Every kilogram of fat Every kilogram of fat that you retain in your body, extra fat that you retain in your body, needs a new formation of blood vessels, like into a highway and freeways and so on, of blood vessels. When you actually extend that highway in a line, you end up with 64 kilometers of blood vessels to support 1 kilogram of body fat. 64 new kilometers. Now, why is it that some people gain weight and the blood pressure rises up? Because your heart needs to send out the blood 64 kilometers further per kilogram of body fat. So if you have 15 kilograms of body fat extra, that's 15 times 64, that your heart needs to push it further. So you might be placed in beta blockers, you might be placed in AC inhibitors, you might be placed in diuretics just to control what? Your blood pressure. Would it call to reason that if we dismantle the highways and we don't have to send the blood all that far off on those highways, that maybe our blood pressure will be easier to be regulated? Now, having said all that, the other day, a lady walked into my office, 65 years of age. She's not overweight, she's full of energy. She has no aches or pains whatsoever. She is extremely healthy, good color. She showed me all the blood tests there. Her iron is good. Everything is fantastic. She doesn't have any weight issues. She's doing fine. She looks after the grandchildren. She's doing fine. Blood pressure, you prepare for this because I almost fell off the chair. It was 200/90. Now, if you don't know what a normal range is 120/80. That's like a normal range. She's 200/90. She is what? She is heart attack individual. She had a whole file she was disclosing to me. Her whole file, they actually picked up her blood pressure when she was 22 years of age. She's 65. I said, how is your kidney function? Good, no problem. No protein in the kidneys. The kidney function is great. One of the things that will be affected with your high blood pressure will be your kidneys. She got picked up on high blood pressure when she was 22. The first time that she ever had a blood pressure test, which probably means that she always had high blood pressure. They were doing some health checks among the public in her area. And she actually wanted to crack a joke. She actually sat there in front of the practitioner. This is a doctor. She actually, to that doctor, the blood pressure of that lady was 125. Sorry, not 125, 225, sorry. 225. Friends, I have only the closest, the highest that I ever took on an individual was on a man that was 197 kilograms, and it was 200. This lady was 225. And she is not overweight. She is within the normal range. The weight is not the issue. She has no issue with the kidneys. The kidneys is not the issue. What is the issue with that blood pressure? She has good color, good absorption, no headaches, no issues with the hands, arthritis, nothing. She is just good. What is the problem with that person? It's mechanical, and the body is responding well to it because she probably had high blood pressure when she was 10, 665. She climbs up, she does sports, she does absolutely everything. Anyone with that, if I get to that high blood pressure, I'll drop dead here. And she's just acting normally. I only knew because she told me and because we checked it. That was the only reason. And I said, how many doctors have you seen? Oh, I've been seeing doctors all my life. I'm just wondering if maybe some things, have you tried the medicines? I tried all the medicines. And no, nothing. I tried for months and months and years, nothing. So it was giving me headache, so I took it off, and that's fine. So the medicine didn't drop it. Isn't that amazing? She's 200 and the medicine didn't drop it. There's something mechanical there that lady is running on high blood pressure. Now that's the highest that I ever encountered, and that was just a few days ago. That is the exception probably in 10,000 individuals, okay? So that is not your excuse if you have high blood pressure, most probably. I never met anyone like that before. So that is an odd case, which actually shows again that everybody is an individual and everybody is different. Okay? So, when you go to an MRI, the yellow there that you see on the screen, that's actually the fat. And as you can see, it starts accumulating in darker colors around the liver and the stomach and the lining, etc. Now, notice the diameter of this thigh. This thigh, in both images, the diameter is not actually that much of a difference, isn't it? In fact, if you look at it as an overall circle, you will even think that the one on the left is actually bigger. You notice that? So the one on the left that has more muscle, less fat, is bigger than the one on the right that has more fat, less muscle. Which means the following. When we put on fat, it doesn't necessarily show out. It can actually be in and is taking the place of lean muscle. Okay? This on the right is the typical effect of metabolic syndrome. When the person is actually gaining all the weight from here up, like in an apple shape, and the legs are getting thinner and thinner and thinner. Okay? Thinner legs and more around here. That is actually part of a metabolic syndrome. Okay? When you have less muscle in your thigh, you actually increase the danger of osteoporosis. So you can actually leak calcium straight from the cow if you want to, or start licking a bone every day. But if your muscle is that small, you are not supporting your bone. And you are actually at a higher risk of fracture because you don't have the muscle. And what is taking the place of the muscle is actually the fat. And as you can see, the muscle there, even the muscle is not lean muscle. Can you see the difference in color between the two muscles? One is more lean, less fat in the muscle. The other one has more fat even in that muscle. Okay? So, the beautiful thing is that there is an achievable way of doing it to reduce body fat. It is achievable, it is doable. You have the mechanisms within you in the form of hormones, and you just need to train certain hormones to work for you rather than against you. We know, for instance, that some of the complications of obesity are stroke, heart disease, diabetes, pancreatitis, arthritis, gout, cancer, gallstones. If you are over 40, you are a woman, and you are overweight, you are at higher risk of gallbladder stones. Okay? Liver disease, lung disease, sleep apnea. What is sleep apnea? Sleep apnea is what, you're sleeping there, your husband next to you, and your husband is sleeping this way. That's sleep apnea. he just forgot to breathe. Okay? In some cases, not in all cases, again, in some cases there's actually a mechanical issue. Sometimes visiting to a dentist that can actually help with the jaw can help with that. There's actually some things that you can insert into your nose when you are sleeping, or around your teeth when you are actually sleeping, that can help you. Some positions with your pillow that can help you with the snoring and so on. But we know that weight is a contributor to sleep apnea. So how much are you going to rest through the night if you continuously... You're never going to a very deep sleep. You're always coming out of sleep continuously. Even if you don't get up, wake up, even if you actually don't realize of that. Had a friend that he managed, he started controlling the percentages of his carbohydrates, and he knew that when he went down to 85 kilos, he was a short man, but when he went down to 85 kilos, which is still probably was a little bit too heavy for his weight, for his height, that man knew that at around 80 to 85 kilos, he will rest better and the sleep apnea will go away. He didn't need the machine anymore. But if he put on weight and he went over the 85 kilos, and he actually knew 85 kilos was the borderline. If he went over 85 kilos, he will not rest well. There was actually, the apnea will actually come back again. All right? So sleep apnea is one of the elements that are a common denominator with extra weight. All this is very doable. To reduce the body fat is very, very doable. You will not believe how easy it is. We are going to finish when we finish the seminars, all the programs of the seminars, you are going to look at your kitchen, you're going to look at yourself, and you're going to say, I can do this. For sure, I can do it. This is something that I can actually do. I did a talk to a group of people that were part of... Do you have Weight Watchers here? Okay. So they invited me to actually do a talk, something additional to what they were actually doing. And because people tend to go to a plateau, you know, and they don't move from that plateau. They drop 10 kilos and then they are in a plateau there. And the organizers of the Weight Watchers event there, they were amazed. Within a month, people were actually losing weight, and the only thing that they did was to turn on a number of hormones within them. Belongs to you. You have them, I have them. Just turn them on. Those hormones were never awakened for at least for the last 20 years. That's what allowed them to gain the weight. Before coming here to the seminars, I was in Toronto. We started the programs on a Friday evening, and we were just doing one at a time, and we finished on the Wednesday. From the Friday, I was staying in the house of lovely people there, and they have a person there that helps with the house duties. And I actually anticipated a few things to her on the Friday before I will actually present it in the seminars. So she started doing it right there on the Friday. By the Wednesday, when we finished the seminars, and she said goodbye because I had to take a plane to come to Vancouver, she said, I have already lost 4 pounds since Friday. What did you do? I said, I just did what you told me to do. I just turned on the hormone. And it was just 4 pounds from Friday to Wednesday night. And it's doable. So, please continue on, because now the next program we are going to reveal to you a hormone that probably most of you haven't heard of in your life. And you have it in there, and if you don't wake that hormone up, it's going to be practically impossible for you to maintain a healthy body weight. So I'll see you in the next program.